Diabetes.
Learn what diabetes is, how it affects your body, and how to manage your health.
This video is useful if you have been diagnosed with diabetes or if you want to learn more about preventing diabetes. What is diabetes? We eat to produce energy. An important source of energy is carbohydrate. Carbohydrate is broken down into glucose. In our body, insulin controls the level of glucose so that it is not too high and not too low. Diabetes is a chronic disease when insulin doesn't work properly or when there is not enough insulin. Glucose will accumulate in the blood. In a person with diabetes, their blood sugar level will be too high. Gestational diabetes affects some women during pregnancy. It goes away after the baby is delivered. However, these mothers are at higher risk of diabetes in the future. Get checked for diabetes if you have these symptoms. Feeling thirsty even if you drink lots of water. Going to the toilet frequently at night. Feeling very hungry even when you have eaten. Feeling tired easily. Slow healing wounds. Itchy skin infections. If you have these symptoms, you should go to the nearest clinic kesihatan or private clinic. If possible, arrange for a sign language interpreter to go with you. You can find a directory of interpreters in the Project Sehat website. Risk factors. Diabetes does not always show symptoms. Many people do not know they have diabetes. They do not have symptoms, so they do not check their blood glucose. Some people are diagnosed late when they already have eye, heart, or kidney problems. Check your glucose if you have risk factors. Catch diabetes early. Let's find out what these are. Women with history of gestational diabetes. Large body weight and having a large waistline. Family history. Physical inactivity or a sedentary lifestyle. Hypertension. High cholesterol. Being an active or passive smoker. Complications. Diabetes can cause serious damage to the body, especially if it's not well controlled. Our blood vessels carry glucose around the body. When there is too much glucose, the blood vessels become damaged. Blood vessels become narrow and stiff. Oxygen cannot reach all parts of the body, like our major organs, and this leads to problems. Heart disease, kidney damage, and leakage of protein in the urine. Numbness and tingling in the hands and feet. Vision impairment, diabetic foot ulcer, depression, hyperglycemic emergencies. Diagnosis: you may have your finger pricked for a small drop of blood. This will be tested with a small machine called the glucometer. If the reading is high, the doctor will refer you for more tests to check whether you have diabetes or not. In order to confirm the diagnosis, blood will be taken from the vein to run some tests. HbA1c measures the control of glucose levels in your body for the past 3 months. Another method that is used to diagnose gestational diabetes in pregnant women is the oral glucose tolerance test. You will be asked to drink a sweet solution at the clinic. After 1 hour, the doctor will then draw a blood sample. Managing diabetes. Taking care of diabetes will help you live a longer and healthier life. Carbohydrates increase blood glucose. You should know which food contain carbohydrates. For example, rice, bread, noodle, roti canai, chapati, potato. A guide for healthy eating is the Malaysian Healthy Plate. Fill half your plate with fiber, 1/4 with protein, and only 1/4 with carbohydrates. A dietitian can help you with a complete meal plan. Daily physical activity like doing housework and playing with your children is important. But for health benefits, you need to exercise. Exercise burns calories, reduces blood glucose, and helps control body weight. For example, brisk walking, dancing, cycling, swimming, or jumping. It'll make you sweat. If you're new to exercise, walking is a good activity to start with. Start with 10 minutes and increase to 30 minutes 3 days a week. As you get stronger, you can increase to 5 days a week. Take your medication as advised by your doctor. Make sure you understand how to take each of them. Manage your stress. Stress can affect diabetes. Get enough sleep. Let's review some of the keywords from this video. Diabetes, carbohydrate, glucose, gestational diabetes, blood vessel, glucometer, HbA1c, Malaysian healthy plate, diet, exercise, body weight, complications,